Hey, Dr. Tracy, board certified general pediatrician. Let's talk wry neck or torticollis. So we've all seen babies who in the first few months of life, they kind of had their neck turned to the side. They like to lay on one side. It looks really cute in the beginning, but then we start to notice that their head gets really flat on that side, and that's really distressing for all of us. So what causes it? What do you need to do about it? What is really the deal? So what we think happens is it just basically those last few weeks while baby's inside of mom, they're really kind of crunched up, and sometimes they're turned to a little bit of one side. So once they're born, they have a little bit of tightening of this muscle called the sternocleidomastoid. It's tighter on one side. When it's tighter, it pulls, so it makes it easier for the baby to keep their head to that side. They don't like to turn the other way because then that muscle pulls. Then we accidentally reinforce this by always laying our baby down in the same way. If you're right-handed, you may always lay your baby down on the changing table with their head to the left. Same thing when you lay down to go to sleep. If you have them in a bassinet next to you, you want them head to be near you, so you might put them that direction. We tend to always feed them in the same way. So we accidentally encourage that. And then what happens is if the baby is always laying to one side, then they're flattening that side of their head. This side of the head, as the brain grows, actually starts to become larger. So we'll actually see flattening on this side and moving in like a lump in the front. So it can be really unsightly cosmetically. So there's two aspects to it. The first aspect is it can cause some cosmetic problems for babies, but the other aspect is it really affects their visual motor development. So how they're seeing the world. If you're seeing the world from a tilt, if you're seeing the world like this, you're not developing your visual motor skills the way that you should. Occupational therapists tell us all the time, it's a much bigger deal than just their head shape. It is a big deal. So there's things that you can do. So if you notice that your baby is always liking to be to one side, this is what you do. The first thing you do is every time you change their diaper, but 3 or 4 times a day, every time is a little bit much, but if you want to, you can do it that often. You're gonna do a little bit of a gentle stretch. You take your hand, I usually take the back of my hand and slowly stretch the chin, allow the baby to relax. Eventually they'll let you go all the way over. And then I take the shoulder and just take some gentle traction. You don't want to rub too much because there's blood vessels and things in there. So just gently stretch. You want to open that up just like you would stretch yourself. Do it for 15 to 30 seconds, several times a day. Really just open and stretch that out. But then change how you're putting your baby down. Every time you put them down, put them in a different position. They want to see you, so maybe put their head down to the other way. Feed them in different positions so that they're not always in the same position. When you lay them down flat, you can even prop them up. You don't ever want to leave a baby propped up, but you can put something underneath, if it was this side, underneath this shoulder, so that the baby is more likely to have to look to the side. That can also be really helpful, but again, never pop your baby and walk away. This is just when you are sitting there and watching them, trying to keep them off that side of their head. Doing tummy time can also be really helpful because again, the babies need tummy time. It's not just for the shape of their head, but again, it affects their visual motor development. So increasing tummy time, doing a stretching every single day, changing how you lay them down so the baby is constantly putting pressure on different parts of their head, and then follow up with your pediatrician. Sometimes no matter what you do, the torticollis is so tight that it really takes a physical therapist to stretch it out. There are other stretches as well. I just always teach people the easiest one because I find if I give them too many in the beginning, that doesn't happen. So you talk to your pediatrician. If they recommend physical therapy, the physical therapist will come to your house or you can go to their center depending on where you live. They'll do some extra stretches with monitor. What happens if it doesn't get fixed? If it doesn't get fixed from a cosmetic standpoint, or if it does get stretched out, but there's already a misshapen head or what we call plagiocephaly. If that happens, your pediatrician and physical therapist might recommend a helmet. What the helmet will do is put pressure on the part of the head that is too misshapen on this side and allow more brain growth to go on this side. So as the baby's head is growing and changing so much that first year of life, you're trying to mold it by doing the exact opposite of what happened when the baby was laying flat. So again, totally a personal choice. You do not have to do the helmet. It is cosmetically indicated, but insurance does pay for it, and I highly recommend them. I've never had a family wish they wouldn't have done the helmet, but I have had families wish that they wouldn't have. So not every baby needs one. They do some really cool mapping where they show you what percentage the baby's head is misshapen, and then based on their age, what is the likelihood it's going to continue to improve once the torticollis is done. So that can be done, which is really, really helpful, and that can give you the best idea whether or not it's something you want to do for your baby. So again, pay attention to those neck muscles in newborns. Make sure they're looking to both sides equally. Make sure they're not always looking to one side. If you notice it, do some gentle stretching. Naturally put your baby in different positions when you lay them down so they're less likely to get flattening on the side of their head. Increase their tummy time as long as you're sitting there with them. Talk to your pediatrician if it's already happened and the shape of the head is abnormal. Talk to your physical therapist and pediatrician about whether or not a helmet might be appropriate for your baby. I hope this helps. Take care.